Hi, I'm Ralph Preston, and on Tuesdays we have this Recovery in Science Zoom meeting trying to bring valuable recovery information to stroke survivors. And today we have Caitlyn Hebb with us. And Caitlyn is the Clinical Operations Manager and a practicing neurologic music therapy fellow for MedRhythms. And she graduated from Berklee College of Music with a degree in music therapy and received her fellowship in NMT from the Academy of Neurologic Music Therapy. And it's always a mouthful. And it seems like everybody graduated from Berklee, but that's a subject for another discussion. So welcome, Caitlyn. Caitlyn's going to talk today a little bit about how music therapy is used to help with cognition. So welcome, Caitlyn, and thank you for taking the time to share your knowledge with us.
Thank you. Thanks for having me. And hi, Polly. I see you here. Good to see you. I see some familiar faces. Yeah, so I'm excited to join you all. Again, my name's Caitlyn Hebb. I am a neurologic music therapist fellow. I've worked with MedRhythms for about 10 years now, and I know that I am a part of a series that Ralph has been so kind to host us on. And today I'm going to talk a little bit about more specifically neurologic music therapy for cognition. So we'll touch a little bit about attention and memory, maybe executive functioning and so forth. And I do have some slides to share, but I do hope that this is a bit interactive. So please don't just stay muted, or if you have questions, you're welcome to ask them throughout. I love some thought-provoking questions, so feel free to throw them my way. I'm going to go ahead and share my slides now, just as we get started. Can you all see those okay?
Yes.
Lovely. So some of this might be familiar. If you were here last week, we had my colleagues Vanessa and Isabel and Liz Ryder from Burke Rehab, who shared a little bit of more of the foundation of neurologic music therapy. So kind of why we use music in neuro rehab, a little bit about the company and who we are. Just if you weren't here last week, MedRhythms Therapy, we are a private practice. We provide neurologic music therapy services. We service large rehab hospitals like Spalding Rehabilitation Hospital, Burke Rehab, as you saw the video last week. And our most recent program is at JFK Johnson in Edison, New Jersey. We also provide services in-home, in person, and as well as teletherapy, so online services. Our mission has always been to provide access to this care. We've seen, from the get-go of why MedRhythms became a company, as we've seen incredible responses to people who engage in music, and further individuals who have experienced a stroke have made recovery or improvement using interventions that we use in NMT. So I'm going to say NMT for short from here on out, just because, as Ralph mentioned, neurologic music therapy is a bit of a mouthful. So this might be familiar as well. So just kind of overviewing us and our service. We have always had the mission of going from, a small practice to providing access across the healthcare continuum. And I would say that later down the line, you'll hear from our colleagues on our digital side or our corporate side that talks a little bit more about how we took access from therapy services and beyond within Tandem. So I won't touch on that today, but that is coming down the pipeline, so stay tuned. Just to go over briefly why music and neuro rehab, again, this might be familiar, but repetition is always great for learning. So music as a stimulus or as a source, or really just as a music therapy as a profession, was mostly based anecdotally on observations of how music impacted behaviors and created change, right? So they saw that individuals who weren't able to speak were still able to sing. And they saw that, individuals who had difficulty with regulating their emotions or response to, for example, if they had increased anxiety, that music had this calming effect and was able to decrease that. And so really, that it was more of a social science model of just kind of observations of how music impacted change. And then around the 1990s, when fMRI imaging became available, we were actually able to see more specifically where in the brain music was being processed, and then further how that impacted non-musical behaviors like language, movement, and cognition. So, one important thing that I'll talk a lot about today, because we're talking about the cognitive domain, is these two principles, both music's ability to have widespread activation, so to use multiple areas of the brain, not necessarily all at once, but to recruit from multiple areas of the brain and throughout our brain. And then the second principle is this idea of music-induced neuroplasticity. So we're using music to create connectivity and ideally induce neuroplasticity through something like a music intervention. This has mostly been studied with musicians. So do I have any musicians on the call? Does anyone play an instrument? Oh, I see Kevin. Yeah. What do you play?
I used to play guitar. I learned it as a kid.
Oh, cool. Okay.
I,
Anyone else?
I played the
I
piano,
Nice.
and
So
I
piano.
was also a Pepsi Generation singer. Us and Michael Jackson were the only two sponsored by PepsiCo in the world. All the Pepsi
Wow.
commercials, that was me.
Okay, that's great. We'll talk a little bit about that later when we get to
That
memory,
is so
actually.
cool. That is so cool.
That is really
I
cool.
can
Anyone else?
play the air guitar.
Nice. Okay, that counts. I'll count it,
That's
you
where
know?
I got to jam up once in a while.
The air guitar, exactly. You got to jam out. Okay, wonderful. So you guys are all a perfect blueprint when we think about using music to induce neuroplasticity. It takes a lot of repetition, right? It takes a lot of repetition and a high level of skill, memory, attention, fine motor movements, right? Muscle memory to be able to master something like the piano or the guitar or your voice even. And so that experience has induced this, new connectivity in our brain. And they found that musicians tend to have maybe a different brain structure, different functional connectivity within the brain. That's getting a little bit into the woods of into the science of it. But really, again, by engaging in music, you've then changed your brain by engaging in music, which is really cool. So really, these are like the pillars of the work that we do. So it's just important to think about as I talk about some of the other specific cognitive areas and goals. So all of that literature has led us to develop the field of neurologic music therapy. And NMT is the application of that science and specifically of music. So music could be rhythm, it could be melodies, it could be familiar music, right? All different aspects of music to non-musical behaviors. And from that science, we developed standardized, protocolized interventions that we use in our practice based off whatever goal we're looking to work on. So maybe it's walking, maybe it's talking, or attention and memory. But we're using music to help improve those areas or potentially maintain those areas, depending on what level of care you're seeking. The most important part is this thing that's bolded down here. This focus is the carryover of that non-musical function. So of course we want you to be engaged in the treatment itself. We want you to be motivated. We want you to keep coming back to therapy or do your in-home practice if you've ever had a therapist assign your in-home program. We want you to be engaged, but the most important part of the work that we do is seeing that we've actually improved your communication and your walking. So we'll try to bring it all back to that at some point. Diving a little bit into cognitive rehab. So more specifically, what is cognitive rehabilitation? Now, has anyone on this call done cognitive rehab before? Yes, Carla, I see your hand raised.
And I'm currently in a program now, and it's so interesting. So part of what was sort of recommended to me is that my therapist, she recommended, she goes, and I have no musical ability. She goes, but, listen to different kinds of music. And so my brother-in-law has a record store. So he's always saying, oh, I found a new artist. And so, but what's interesting, and I have to tell, this is one of my favorite stories. So every day I go to Alexa and I'll just say, Alexa, play the top songs in Portugal today. And they'll play whatever's popular. And so the other day I said, play the number 1 song in Zimbabwe. And it was I Got You, Babe by Sonny and Cher.
Nice.
Really? Oh.
Okay. Well, that's
Well-
so.
Oh,
So you,
go ahead.
I was just going to keep going for sake of time, but if you're on this call, if you've experienced cognitive rehabilitation, you know that it can actually be with a variety of tasks, right? There's actually kind of, merit in having some novelty in a task. Once you've mastered something, obviously, it doesn't have such a heavy cognitive load. You might need to do something else to keep advancing. So it can be, and a variety of clinicians will address cognitive rehabilitation in various amounts of ways. There's a little bit of a difference between restorative or really trying to access neuroplasticity, improving areas of cognition without support and cues, right? That's a restorative or recovery component. And then there's also cognitive rehab that focuses more on compensatory strategies, such as memory books, right? Voice memos, setting alarms in your phone, calendars. Some examples here on the screen you'll see is, puzzles, cooking can be a cognitive task, going out in the community, building a shopping list, balancing your checkbook, right? Simple or complex math. All of that can put our cognitive skills to the test. So when we think about using the role of music or NMT, again, when we break it apart in cognitive rehab, we like to think more specifically about particular goals. Are we working on arousal? Are we working on attention? Are we looking at someone who might have visual-spatial deficits like left neglect? That might sound familiar to you if you're on the call. An ability to perceive the left side. We'll get into that a little bit more. Short and long-term memory, and then those areas of executive functioning like organizing, problem solving, decision-making, and sequencing. This is the areas that you would be looking at in cognitive rehab, but also in NMT, we address all of these goals, but our mechanism or the source that we use is music. So to break apart music just a little bit, because I think when we hear music, we automatically think of our favorite song or our favorite composition, but music is a lot of things, and a lot of things make up a composition or music or your familiar song. So for example, the first one is called rhythmic entrainment. And this is the brain's ability to really take in a rhythmic pulse. So if you've ever heard a beat, right, or a rhythm of a song, your brain is able to analyze that information and really process the intervals of time in between. So I'm going to give an example of this. Has anyone ever heard of a metronome? Yes. Okay. If you're a musician, you probably have. You either love it or you hate it. It's just kind of comes with the territory. So I was a vocalist, never really loved the metronome until forced. This is not a metronome. This is a simulation of a metronome on my phone. Can you hear this? Clicking. Right. So I saw some people immediately. I turned on the metronome and they start going like this. When I asked, did you hear it? You're almost bobbing your head to the beat, right? This idea is that you can hear those intervals of time. Your brain can take in that information, and then it can actually anticipate when the next beat is coming, right? And this happens very quick. You're not cognitively actually thinking about pulse, think about it, pull, right? Like this is all happening very quickly, kind of, below conscious learning. You don't actually have to really think about it. That is very critical. That entrainment is critical for a lot of the interventions we use, and I'll talk a little bit about how it's specific to cognitive rehab. In addition to rhythm, we also think about melodic patterns. So you might have heard a melody that goes ba-da-ba-ba-ba. And if you know what it is, that might be leading you to think of French fries or a cheeseburger, because that's the McDonald's slogan, right? I'm loving it. So this melodic pattern that we're able to, our brain kind of takes in, and it integrates all of these like sequentially ordered sounds, and it basically it attaches a pattern to it. And so it's also really interesting how in Western music, we kind of know there's this like expectation of where a melody or harmony should go. And again, you don't necessarily have to be a trained musician to know these things, right? If I went ba 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 you know, right? It has to come back to that note. It has to end there, because that's where melodically we've learned that pattern in that order of notes. And then I would be remiss if I didn't mention, of course, the emotional saliency of music. We all probably have a song or again, a composition that we have very strong emotional connections to. And it's actually really interesting when you think about how music does create and is thought to kind of increase blood flow areas that are implicated with reward, motivation, emotion, arousal. And what's cool about that, and why I put this below here, is because we're talking about cognition, and emotion is kind of a critical component, or is thought to be, of like a memory enhancer. So now we have this really emotional salient source that's music that we're using to improve memory, right? It's almost like a power tool. Okay. Oh, hold on. I gotta pause all my videos so that you don't hear them all at once. So now to get in a little bit, all those music mechanisms, we're gonna get into more specifically, okay, Caitlyn, what does it actually look like when we're trying to work on arousal, orientation, or attention? I'll start. So we'll kind of build up this, build up the cognitive, pyramid, if you will, to start a little bit with arousal and orientation. I'm only going to touch briefly on this. I probably won't show the video because I'm going to move, for sake of time, I want to go and spend more time into attention and memory. But even starting from the groundwork of using music as an arousal source. So really trying to think about different aspects of music. Again, picking apart, we're going to use the music as the sensory stimulation. So for some people who are experiencing more severe brain injury or, severe stroke kind of early on in recovery, we might be looking at just getting eye-opening, right? And in response to music, we might be looking at just getting, very early voice or familiar words within music. And so we're really looking at more of like, how many responses to music are we seeing? And when we use something like music at that early of a stage in recovery, we often find that we get an increase in response compared to some of the other stimulus that might be used in cognitive rehabilitation. So again, I don't want to touch too briefly on this, but the idea is that even from early on, we can use music as a way to launch into recovery. And then as we shift from, our arousal, our arousal is high, we're able to keep our eyes open, we're able to be oriented to where we are. We then start thinking about attention. And so attention, there's a lot of different types, right? We have sustained and selective. We have this concentration, we have focused attention, alternating attention, and then divided attention, which, to be quite honest, I don't know a lot of humans that are great at dividing their attention, but it's always good to practice divided attention. So I'm going to touch base a little bit more on sustained and potentially some alternating or selective attention. I'm going to show a video of someone I worked with in an inpatient, but we're really just working on using one stimulus. So you'll see me here, I'm playing, this is a paddle drum. And what I'm going to do is I'm going to play a pattern and I'm going to ask that the patient repeat that pattern immediately to me. Okay. And the pattern is going to keep changing. So I'm not going to keep it the same. I want them to change that pattern with me. So I'll show you what this looks like. Good. Listen to it again. Ready? Can you hear that okay? So you get the idea, right? I'm changing the patterns. At first, he's not attending, right? He made a mistake in the beginning. So when I redirected him back and we kind of have, as I said, the metronome is going and keeping the time. I'm asking him to repeat those patterns and I'm changing the stimulus. So this is an example of something early on where I would just be focused on sustained attention, responding to one source at a time and changing based off that. That could also look like, for example, speed up and slow down. So sometimes, you know, we'll use our guitar and ask the patients to play the drum fast when I play fast, or stop and start when I stop and start. So that's kind of early levels or the bedrock of attention being that sustained. Then it might transition into something a little bit harder where I'd introduce an additional source, right? So I might be playing guitar, but I also have a foot tambourine. Has anyone ever seen a foot tambourine? But basically you attach this little tambourine to your foot. So it's kind of unique. Probably only music therapists have seen it, if I'm being honest. But you use another instrument or another source that the patient has to respond to. So I might be playing my guitar and asking them to play, but only play when they hear the foot tambourine, not when they hear my guitar. This creates somewhat of like a distracting component to the attention, right? The demand on your attention. And so that is how we would kind of work on different levels of attention, adding different stimuli, but being music, right? Of course, I'm using music as a stimulus, and gradually making it harder to address different areas. One other example I'll use is that if I'm working on just something like vigilance, I might say, I'm going to sing a song. So we can do this now. I'm going to sing a song. If you're listening, I want you to listen for one word, and that word is going to be sun. You ready? So I'm going to sing. Every time you hear the word sun, I want you to raise your hand. Okay, here we go. Oh, yeah. Nope. Wrong song. Wrong Beatles song. Here we go. Little darling, it's been a long, cold, lonely winter. Here comes the sun, doo doo doo. Here comes the moon, and I say it's all right. Do 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 do. Here comes the sun. Here comes the sun, and I say, it's all right, right? So you're picking out one word. If you want, I can just do that for the rest of the presentation. We'll just sing songs for them, Yeah, I think Lewis would agree to that. But yeah, so you're picking out one word, right? So in all of these different stimuli, and I might not necessarily always give you what you expect to hear, right? I might change up the words, but you really have to attend to that task and pick out when you hear that word.
I think it's a ruined moon.
Yeah, I did. I threw in moon. That's right. The moon's pretty too.
Oh, no, I know, but I was expecting sun.
I know, exactly. Okay, so to move forward, when we think about attention, I put this in here because I imagine those who have experienced a stroke, some of you, if you've had a right hemispheric stroke, you might have been impacted in the way that your brain perceives the left side of your body. And so we call this left neglect. Has anyone on the call experienced left neglect or have heard of left neglect? Judy, I see your hand. And Martha, Randall, okay. So this, it is pretty common in that if you've had a right hemispheric stroke, you might have some of these issues of perceiving that left side. And so it's not that you're right, it's not that your eyes don't work, it's that you're not visually processing the information. And so for us as clinicians, what we typically do is we will use music to drive the attention over to that neglected side. So we're going to use things in instruments, right? But typically we use rhythm, we'll use melody to really drive over to that left side. And so I'm going to show you a video of what this looks like here. This was a co-treatment with occupational therapy at one of our locations, Spalding Rehab. So you'll get to see a little of this patient kind of at the baseline when we're asking him to find the bells. And you'll see that he really doesn't get the far left bells at first. Good. There are actually a couple more. So there's one over here. That's the third one. And then there's a fourth one all the way to the left. Can you try to play all of them? There's one more. It's yellow.
All the way to your left.
Red, green, blue, yellow. Again. Good, back again.
Back to red.
Again. So I'll pause it there because you probably get the idea is that I've spatially configured these bells, right? These bells are, I oftentimes call them my magic bells because we use them a lot in clinic. And if you are working with an occupational therapist, they typically try to steal these bells from me, so I keep them hidden. But the idea is that you're spatially configuring these bells from far right to their far left side, which might be neglected. And now that he knows the melodic pattern, right? He knows it's red, green, blue, yellow. He has to complete that pattern before he starts over again. So after you hear that melodic recognition, right, your brain has taken that melody, those pitches, and it's put it into this pattern. And now you need to complete that pattern, requiring them to really search for that pattern on the neglected side. Now, if you've experienced left neglect, you know that really it takes a high level of repetition to retrain your brain to perceive the left side of your body again. And so this is something that, you know, this is more of a, when we think about cognitive rehabilitation, this is much more in that recovery model than what you might have experienced more compensatory, where they put a piece of red tape on the left side, or, you know, they might put something on your door so that you don't hurt your arm when you bump into it. Those are all more compensatory, right? You're basically putting in strategies that help you become aware of the left side versus actually retraining your brain to perceive the left side, which is what using music or an auditory stimulus is what we do in practice with our intervention. And so that can be really, really effective. And I'll say, if you have this and you're interested in trying something at home, and maybe you have, you know, you can use different instruments. You don't have to have these bells, but you could use a piano. I've done even rhythmic neglect training if you're using percussion. And so happy to talk through if you're interested in trying some of this to really force your brain to pay attention to that left side. All right. I'm going to talk a little bit about memory now. Is anyone working on memory still? Does anyone feel like they still are challenged by some memory in the work that, or maybe a little bit, some people? I mean, I think I do at times as well. So working on memory, there's different levels of memory. I'm going to show you an example of what's called music mnemonics training. You're actually probably familiar with mnemonics. In general, they are mnemonics is a really helpful tool for memory, where it basically kind of chunks information together for you. It could be a phrase that you use. It could be a word that reminds you, each letter. For example, when I learned guitar, the strings, it's every good boy deserves, well, I've forgotten it already, but basically each string has, I forgot what the mnemonic
Every
was.
good boy does
Does-
fine.
Does fine, or deserves fudge is how I learned it,
No,
actually.
yeah, but yeah, my guitar teacher was stringent about that for me.
Yeah, there you go, right? So each string has a word, and that's a mnemonic, right? It helps you remember what each string was. The good thing is I remembered what each string was. I just didn't remember what the mnemonic was, so it kind of worked. And so we use these actually often in music as well. Marketing for many companies has used music mnemonics. So for example, the ba-da-ba-ba-ba, right? That's a mnemonic that helps you think of McDonald's. Or if I was to say, the best part of waking up is Folgers and ink. Exactly. Although Folgers is probably, I mean, no offense if you're a Folgers drinker, but in my opinion, it's not the best cup of coffee. So the idea, though, of that is that they've used this melodic contour, or this, this melody that they've created. And that information has helped really chunk all of what they're looking for, which is when you wake up, they want you to think about their coffee. Now, as a clinician, I'm not trying to sell you things. Of course, I'm not trying to make you remember things that are, useless. I want you to be able to remember things that might be hard to remember. And that could be across, your recovery. So that could be early on when you're really just trying to orient yourself to place or month or year, right? Sometimes that can be challenging when you're in a hospital. As you progress, that might be your address, or it could be that we really just want to train your short and long-term memory, or your recall of information that is valuable to you. And then again, when we think about the more neuroplastic change that we're looking for, the more you practice using mnemonics, ideally, the better and you've improved your memory overall. So the need for using mnemonics becomes less. So this could be with a ton of different information. You could do it with names. You could do it with your shopping list. Again, you could do it with your address. Really, depending on what you're doing in your life, you can adapt and create a song for. So I'll play a clip of someone that I worked with. And this is in a hospital. So we're really working on those early parts of memory and really trying to help him orient to where he's at, what the month and what the year is. You remember where you are?
Yep.
What's the name of it?
Spalding.
Yeah, that's right. What month is it today?
September 22.
2022. So you can hear in this example that, again, I don't want you to have to go out and have to sing the information, right? And I want you to be like, I am in Boston, right? To remind yourself. But the idea is that you practice it. You use music as the tool, and then you take the music out of the equation and you practice, you hopefully are more oriented or be able to remember that information. The one thing I'll say about this is that depending on where you're at with your memory goals. So I would say if you're really trying to work on maybe a more complex memory information, something like a list, a grocery list, right? You're not going to write it down. You're actually just going to go and try to remember it, which I very rarely do. Otherwise, I end up with more things than on my list. But the idea is that if you're going to try to use this, you usually want to have a melody that's not closely associated with something else. So for example, you wouldn't use the tune Twinkle Twinkle Little Star, because when you try to remember that information, you might have a harder time because you're just remembering the words to Twinkle Twinkle Little Star. Unless you have really practiced, so you can use something that is familiar or a melody that's overlearned. But again, you have to determine if that's going to impact your ability to remember what you want to remember versus the familiar song that you already know. So I've seen people who have taken, Beatles songs or have taken something that, patterns of music that they know pretty well, but it doesn't impact their ability to remember the information. And then there are some people that you should stick to more novel or new melodic lines. And I'll just add, that's typically something your clinician, if you worked with an NMT, that they would work to help you figure out of like which you should try to use first. Okay. Oh, I went through it all. That's great. So I'm going to pause here because we talked about memory, attention. We talked about, music and neuroscience. Are there any questions? Let me stop sharing. Are there any questions about the content that you heard today, or anyone feel like they are interested in trying these things? What are your thoughts? Carla, I see you have.
Well, I have an interesting, because my brother-in-law has the music store, and as a person of a certain age, and 80s music is very popular, and I read an interesting theory about it a while back that said the reason, especially like with people, the reason that music is so popular is because that was when music became associated with videos. Like, right, certain Michael Jackson songs, I could just picture, the thrill of the videos, and I read it was really interesting. It said that music is so powerful to us because it's stored in a different way in our brain than other regular songs that we might have learned as children, because it's associated with all this visual. So I thought that was super interesting,
Absolutely.
What
I
are the- recently was doing some light reading of research and had really, it was quite interesting to read upon musicians. I think musicians are, again, a really good model when we think about how music truly impacts both how our brain communicates, but also structurally how it's shaped, right? There are areas of musicians' brains that are thicker than non-musicians' brains. And because they've had that high communication between, for example, auditory and motor areas of the brain, or certain fiber tracts that, that create that communication or connectivity. And so one of the studies that I talked about was that musicians tend to have a better ability or capacity for working memory as it relates to auditory and verbal learning with working memory. And so I think it makes a lot of sense when you think about, memorizing pitches and, the sequence of notes and organizing all of that information really quickly to be able to repeat it or play it back or, so forth. There's so many ways that if you're, curious or kind of interested in challenging yourself cognitively, even starting by, picking up an instrument and learning some basic music would go a very long way for all areas. Yeah.
Yeah, Judy. Oh, you're muted, Judy.
I'm reading an article right now in a magazine called Brain and Health, or Brain and Life. And it's soprano Renee Fleming wrote an article. And evidently she spearheaded a research study, NIH, and the John F. Kennedy, you familiar with that? Performing arts, called
Yep.
Sound Health.
Yep.
And they're studying the effects of music on the brain. I just wondered if you were familiar with that.
I am, yeah. I think they put out an article recently that talks about research studies and for music and health. I think one of the limiting factors of evidence in using music is that it in general, it just hasn't been studied for a very long time in comparison to other things. And so how do we have more research about it, but also how do we design our research to show the efficacy of it? So I think Renee and that team and, working with NIH to create those studies is fantastic.
Well, we also, I think we have to like change public thinking, because think about it, when the budget needs to be cut, what's the first thing that goes is the music program. Music isn't really, I just remember always having music classes as a child. I remember my music teacher telling my mother I was retarded, that I would never learn to play, needless to say, she didn't work there long after that, but it's like music. It just seems like music isn't really valued anymore. It's seen as expendable, and I think, which is a real shame. It isn't. Music isn't really valued, I think, in a lot, other than entertainment. But as far as the educational tool and as part, just part as overall health and well-being, it isn't really valued. Unfortunately, it's very sad.
Yeah, in comparison.
I can also add in. Hopefully you and I can talk in the future. Being a Pepsi singer, you have to learn how to sing the song and see it at the same time, because they don't want to do commercials over and over and over. Okay. My mother has a PhD in English. And one of the things that she said was, you use both sides of the brain, because you sing, you see the words. And I was told when I had my stroke that because of my aphasia, I would never speak clearly again. And they brought my CDs and all my songs. And I was singing after 2 weeks, all of the songs that I sung on the commercials. And then from there on, I've written a book. I sing. When like the Mayo Clinic or the rehab center had said, you'll never speak clearly again. And I think when you don't know the history of somebody and music, you can be very wrong.
Yeah.
Well, you'd never know. I didn't know your history. You'd never know that you had aphasia. You speak perfectly.
Thank you. Singing.
One
there
thing,
you go.
Kevin sings an hour a day.
I love that.
And before it gets too far in the past, what we need is to bring more attention to the power of music, and so there'll be more studies, because until everything's evidence-based, it's not going to get prescribed like physical therapy does, and so that's why I think it's really important that any and all studies go on, because before something becomes commonplace, the people that pay for it need to make sure it's effective.
Yeah, I would encourage you, if you're curious about reimbursement and funding for something like this, music therapy or services, neurologic music therapy. One thing to keep in, there is a body of literature that supports the interventions that we use in practice, and we actually do have the capacity to bill under certain codes that might be used by other professionals. The tricky part of that is if you're getting rehab, that it's challenging to do double billing. And of course, sometimes most insurance companies will deny at first maybe even second or third. But I would encourage you that if you're motivated to use this, that oftentimes you all are your best advocates when it comes to that, and taking no for an answer. Don't take no for an answer is what I'd say, because we do have literature, we do have research that supports what we do. And I'm happy to share that. I think I owe someone from last week some information about someone who was here for the presentation about what they could provide to their insurance companies that would show evidence that we currently have. So if you are interested in doing that, I'm not guaranteeing it. Of course, it will be a challenge, but we do have the start of that. But yes, to your point, Ralph, we're not done, and we still have a long road ahead of us to be fully reimbursable by insurance.
Can I say something quickly? For those that don't know me, I work with Ralph in Stroke Buddies, and I teach guitar and piano to stroke survivors. So if anyone wants to try get started, they can contact me or Ralph outside the call.
Cool. All right, Debbie. Oh, Debbie.
Thank you yes.
Hi.
Hi, thank you so much. Quick question. It may have been asked in previous sessions, but how would just singing along with the radio help? Does this help?
Yeah.
Because I used to play piano many years ago, but I don't have a piano and I have right hemiplegia. So just singing with the radio.
It depends on what you're looking to work on. I would say yes, if you're thinking about for your communication, for any speech goals, for language goals, 100% singing along, singing as much as you can, as I think as Brady had mentioned. But that idea is that you are strengthening connections using music to the right hemisphere, and thus that there is literature that supports that it will improve your access to language and improve other areas of communication like articulation, motor planning, etc. If you're thinking,
that's perfect.
Yeah, absolutely. For movement, singing along, I don't know that there's anything to support that. But I will say that again, in my very fun readings that I was having with research, they did, I did come across a study that talked a little bit about even passively listening to music can potentially improve aspects of memory as well.
That's fantastic. Thank you so much.
Yeah,
Because
Randall.
my speech has definitely gotten worse, not better. So I need to improve it. And I was wondering if that will work. Thank you very much.
Absolutely.
For those who don't have access to instruments, there are a lot of free phone apps on the Apple Store and the Google Play Store where they're like little phone pianos. You could use one finger, and there's guitar versions as well where you can scrape your finger along the screen and play chords. So if you want the aspect of physicality without needing to go buy an instrument, just look on your Play Store.
Thank you.
You're welcome.
Randall, yeah.
Yes, I had a question. I think Ralph had said that singing 1 hour a day will help you do better, but be better at what specifically?
So I don't know about the timeline of singing 1 hour a day. I think that's what Kevin does, right? You sing 1 hour a day.
Yes.
Yeah.
Yeah, I've read an article and they're talking about aphasia, and it helps if you sing along and recreate some of these connections, like Caitlyn says, and just doing it and repeatedly and singing along to your favorite songs. So it's just what I do. It's just a thing I do, but I've read about it online recently.
That's great. Yeah. But the idea, Randall, just so you know, is music is typically, when we think about speech and language, in contrast to speech and language, music recruits a lot from the right hemisphere when we're singing. And so speech and language tends to be more in our left hemisphere. It definitely recruits into the right as well through different pathways, but usually it's kind of located in your left brain. So if you've had a left hemispheric stroke and you're experiencing difficulty with aphasia or accessing words, language, so you might, see this word or, item and you know that it's a pen, but getting the word out is challenging, right? If that's the case, using something like music or singing can access language or words and recruits from the other part of your brain, your right hemisphere, that isn't damaged, right? That didn't experience a stroke, and can kind of in a way reroute our accessibility to that language. And the more you practice recruiting from the right hemisphere and accessing that language, the stronger those connections will be. And then ideally, you'll be able to access those in absence of singing as well. So that's really the idea of like that neuroplasticity change and using a different route to get the same behavior that is communicating. I feel like all of your questions are a perfect segue into next week because I'm actually coming back. Surprise! I'm coming back for another part to talk about using music to help with communication, voice, breath, and really all things speech related. So I've got different examples and ways to use music to help with communication. So if you're interested in that, come see me next week because I'll be here. So.
Great.
All right.
Fascinating. Thank you so much.
Absolutely.
Yes.
Thank you for being so
Thank
awesome.
you. Thank
Oh,
you.
thank you for coming.
This
Do all you can with what you have, in the time you have, in the place you are. Do all you can. Do all you can.